Welcome, everyone. My name is Ashley Jones, and I'm here with Women Like Me. And today we're having a very long overdue, but an incredibly important conversation about pelvic floor health. We're going to figure out what exactly that is, how common it is, although it doesn't have to be normal. We have a lot of stuff to discuss, and I'm so thrilled that you're here and you're ready to join us. If you've ever had any kind of bladder issues, if you're jumping on the trampoline with your kids and you feel something, if you've had any discomfort in that area, or you just, there's some stuff that you're unsure of and you have a lot of questions and you don't know who to ask. We are here today to address all of those things. One of the main things at Women Like Me that I love is the community there. And I love how the partners that we choose to work with really empower your health and wellness journey, just like Kaia Health is today. They're a perfect example of our mission statement and why we're having this conversation. So I want to welcome Kaia Health. So ladies, introduce yourselves. Courtney, you go first.
Hi, Ashley. I am so thrilled to be here, and I'm so excited Kaia Health can be part of this conversation and educating people on pelvic floor health and how they can treat any pelvic floor issues they're experiencing. I am Courtney. I'm a senior health coach at Kaia and also a recipient of pelvic floor therapy, and happy to be on the other side of it, living a great life.
I can't wait to talk to you a little bit more about that. Adrienne, would you introduce yourself to us, please?
Of course. So my name is Adrienne Colman. I'm a physical therapist here at Kaia, and along with Nicole, I help develop all the clinical content that goes into the app. We ensure that it's clinically sound, exercises, education, all of that's appropriate for us to better help you.
I'm so impressed with you guys. Nicole, will you introduce yourself, please?
Yes. Hi, Ashley. Thank you for having us. I'm just excited to be here to be able to share what we offer and how it can hopefully help millions of women. I'm one of the physical therapists at Kaia on the back end who makes sure, like Adrienne said, that everything we put forward to our users is evidence-based. Latest evidence supports what we have with exercise and education to support our users.
I'm thrilled that you're here. I don't think we could have brought together a better team to have this conversation. I'm going to start with Courtney Mills, a senior health coach who has personal experience participating in pelvic floor physical therapy. And all of these women bring a wealth of knowledge in designing and implementing pelvic floor therapy, specifically, obviously, for us women. So, okay. We're going to break down so many myths, and we're going to answer a lot of questions. I'm going to start with a very obvious one, and I hope you guys can answer. What is pelvic floor health, and what can we actually do about it?
I can start. So pelvic floor health is just basically what it's saying, the health of your pelvic floor. So your pelvic floor is made up about 14 muscles, and those muscles sit inside of your pelvis. So as they're sitting inside of your pelvis, they support the bladder, the uterus, the rectum, and it's part of your core muscles. So your core muscles involve like your abdominal muscles, your back, the muscles at the side, but at the bottom, you have that pelvic floor to kind of hold up all of these muscles so that you're not urinating at random or the urgency and stuff like that. And all men and women have one. And I can let Nicole go into a little bit more detail about those muscles of the pelvic floor and why they matter.
I'd love that. Nicole?
Sure. So if you picture a bowl, so you have a bottom and it comes up on the sides, that is our pelvic floor. And there's 3 different layers. So we have all different layers that make up kind of the base of where our vagina and our anus are. And so those muscles help keep our organs in place so they're not coming out. They help us promote good sexual health by helping us relax so that things aren't painful. They help us contract and relax certain muscles so that we can go to the bathroom without pain and efficiently. And so they play a major role in our day-to-day function and our organ health as well.
When you guys were just describing I will talk about this a little later, but I think people don't realize how important the pelvic floor health is in securing that and strengthening that, and how it can lead to, like you said, back problems. And it kind of leads me to the next question about can you give me some symptoms that we can look for if we feel like there might be some pelvic floor dysfunction? And what should we be asking our doctors?
So you can, if you're just out and about with your girlfriends and you start to laugh and that laughing causes you to pee a little bit and you're like, what is that? Or if you're coughing and you pee, a big sneeze and you pee a little bit and you're just like, where is that coming from? Those are some symptoms. Another symptom is when you first have that urge to pee, we should be able to hold that. But if you have the urge and immediately you have to run to the bathroom, like that's another symptom. Or how often are you using the bathroom throughout the day? That's another symptom associated with. And let's move it over to the bedroom a little bit. So if you're having a little pelvic pain or discomfort during intimacy, or even fear of intimacy because of the pain you're experiencing down there, that's another symptom. We also don't want you to feel pressure down there or heaviness in the pelvic area throughout the day. That's not normal. But some women think that all of these symptoms are normal because they've either had kids in the past or they're just aging and they're like, oh, I'm getting older. Peeing is perfectly normal when I cough or sneeze, but it's really not.
I think we have been accustomed to, we've grown up with our elders and, aunts and grandmothers and people like that all kind of led us to believe that this is just what happens. And so we get to a point of, oh, everyone kind of experiences it, and we get to a point of acceptance instead of realizing that there are things that we can do. I'd love to, what I think happens to a lot of women is, and I mean, even me during this conversation, I want to say, I don't really want to be the one to say, I'll go first, but I'll go first. I can do that because I think it is so common, but there is a lot of shame wrapped up around it. And I don't think that when we go in for our physicals or we go into our OBGYNs or, our hormonal health doctors or even Kaia Health, which I'm hoping people will find as a humongous resource for this, but we don't feel the need to speak out about it because there is a lot of shame around it. So how can we get women to start, there's a big topic right now. Menopause is now coming in the forefront. How can we get the pelvic floor health in the forefront, just like menopause, and get over that shame?
I mean, I'll go. I think talking about our stories is foundational. I was interviewed a while back when we released our pelvic floor product, and that's published out there. You can read the whole article if you're interested. Look at Kaia Health pelvic floor. And I talked a lot about my journey. And I'm a health coach, so I talk to people about all things related to their pain and lifestyle and well-being. And the release of our pelvic floor product was absolutely perfect timing with the existence of my own challenges postpartum. And I was one of those people that was blissfully unaware of my pelvic floor existing until I needed it to exist. Pregnancy was where it started for me. The third trimester, my daughter was in a position, she placed tremendous pressure on my pelvic floor, and I was in pain nearly all the time. I lived in New York City. So for those of you that visit New York City or live in New York City, you know that there's no restrooms anywhere. So I also had a problem with holding my bladder a lot. And so I went through pelvic floor therapy initially during pregnancy. And then about 13 months into my daughter's life, I started to experience perimenopausal symptoms. And so I had all these things line up. And then my daughter was also very clingy. So I wore her basically for 2 years. And that put a lot of pressure on my pelvic floor. And it all came to a head when she started daycare and brought home the plague. And then once she started bringing home plague after plague, this one virus I got, I literally coughed and sneezed every minute for about 48 hours straight. And I walked myself to the store and bought some Depends. And that's when my pelvic health journey truly began, because I was done ignoring the urinary leakage. I was done doing laundry. I was ready to address it head on.
That's a really powerful story. You also look so young. So I just want people to understand if you're experiencing this, and you look like one of us, this is normal. But it doesn't have to be, it doesn't have to stay that way. I would like to talk about, what do we do now? What's next? Tell me where you are now in this journey? How old is your daughter? Where are you now? Do you feel like you've conquered a lot of those issues?
Yeah. So my daughter's 3, almost 3.5. She still likes to be uppy all the time. So that's still a challenge, but I'm happy to say that I am able to take a dance class once a week. I no leakage. I'm able to lift weights again, which is a really, really important part of my existence. I love lifting weights, and I had to put a pause on that because any pressure was a disaster. I can happily exist in a virus setting. And for the most part, there may be a little bit, because pressure is pressure. At some point, it's going to give way, but nowhere near to the extent that I was experiencing before, where I was doing laundry all the time and dealing with that sense of like embarrassment and shame of, oh, here we are again. I'm out and about and I have to go change. So I would say 95% better. It's incredible.
Adrienne, do you mind sharing a few of the actual treatments and approaches that we can do to where we can have a success story like Courtney's just described?
Of course. Depending on your symptoms and your goals, we recommend in-person or virtual or digital. So if you have to have some type of treatment that's internal, of course, we recommend in person. Virtuals, if you want, more of that personable experience, but you don't want to really go in person to a clinic and drive. So you can have that one-on-one with a physical therapist virtually, or here at Kaia, you can do it digitally, where exercises are very effective in treating your pelvic floor symptoms. So we have guided exercises in Kaia Health, and it helps build awareness, strength, relaxation, endurance, and coordination. So we have programs, things like Kaia Breathe, and then pelvic floor awareness that we have with our education, and it goes a really long way. So we can help in several different ways.
I got the opportunity to download the Kaia Health app and play around with it a little bit, and I was introduced to my, my point person that kind of helps guide me through the whole thing. So I learned quite a bit about that. Are there exercises that could we interact with Kaia Health and do that at home, Nicole? Are there exercises we could do at home right now where we could get to where Courtney is today? So if I'm jumping on the trampoline, I don't have to make sure that I have an extra pair of shorts or leggings with me.
Absolutely. So we designed our program with the foundation of education and knowledge being at the basis. So knowledge is power. Just learning a bit about the pelvic floor, what it does, and why you might be experiencing symptoms is the first thing that we believe we should provide users with. And then they can learn a bit about their symptoms and why they might be experiencing them, and coach them along with the questions to ask. Our exercise programs are all made to do at home. So in the comfort of your own home, we encourage that if you feel safe, you can close your eyes, you can dim the lights. The foundational pelvic floor exercise is just learning to breathe correctly, because our diaphragm and our pelvic floor work together. And if you're not able to relax your pelvic floor because you're fearful you might go to the bathroom, you're not breathing correctly. And that's oftentimes why people might have back pain, groin pain. They might experience pain in different areas because they're not breathing effectively because their pelvic floor is not relaxing. And so being able to do that at home without the fear of maybe going to the bathroom at the clinic, or I have an infant, I don't want to drive all the way there, can I practice this at home? We've been there. I've been there. I actually went on to get advanced training because I asked my OB if I could get pelvic floor therapy, and he said, this is normal. You're postpartum and it'll get better. That was his response. And I was a PT. And so then I went on to get the training. So I'm like, women need to do this in the comfort of their own home. Unless you need in person, there's always a time and a place to maybe have a hands-on treatment approach, but oftentimes that can be done in conjunction with what we offer at Kaia.
That's really, really good advice. And you're right. Knowledge is power. You're meeting people where they are, wherever their needs are. You can supply that need, and it can be met. A lot of times it's financial. When you have young children at home, you have to provide a babysitter in order to go in person. So if this is something you can do in your own time, in your own comfortability of your home, like you were saying, that's invaluable, I think. And I think it's a great resource to offer. The more you're talking, the more I'm thinking, wow, I wonder if this has to do with my sleep, and how if my pelvic floor isn't strengthened, that's why I'm not breathing very deeply and my back is hurting. I think there's a chain reaction. When I was able to play around with the app and look around, a lot of different information came up. And one of the things that we talked about in our preliminary conversation, I said, I didn't realize this was connected to my back and shoulder pain. So I plan on going much deeper with you guys in this. And the next question I would love to ask is, okay, So someone like me that I'm just now, it's funny. I was on Bold and the Beautiful, or I am on Bold and the Beautiful, and my character, very early, I mean, she was in her 30s, but she dealt with a weak pelvic floor and it affected her pregnancy. Courtney, a little bit like what you were saying. And it was a little bit of awareness. We didn't go that deep, but it was my first experience talking about pelvic pelvic floor health and how that supports your pregnancy, but it also supports all your other organs. And then I had to strengthen my pelvic floor before I could try to get pregnant again, my character. So I learned a little bit about it then, but not that much. And it's funny, it doesn't really, like Courtney, I feel the same. I really resonated with what you said. You don't really understand how important it is until you have to find out how important it is.
Right.
And I think a lot of us get to that point. And if you're watching this and you're this far into our conversation, you're here for a reason. So what's the first step that someone can do if they're just afraid or unsure or they don't want to talk about it at all? Can you just, like, Courtney, what would you tell someone, because you've been through this?
Yeah. So again, I think that knowledge, as Nicole was saying, is power. One of the first things that I did before I even actively started the physical therapy portion of my care was a bladder diary. And that was actually really foundational for me because I didn't realize what I'd done during pregnancy was essentially train my bladder to be too sensitive. And so I would go to the bathroom really frequently, and that actually increased my urinary issues. So the first thing I did was keep track of how often I was urinating and push that time a little further. So I trusted my body to be able to hold for a little longer, 5 minutes at a time, 10 minutes at a time. And that was very actionable for me. And I know I'm a person, I know a lot of the people I coach are also people that feeling like tangible results, feeling like you're moving in a direction is incredibly motivating. So I think that's actually a really great place for people who are having urinary symptoms to start, is to take notice of how often you're urinating and see if you can go longer in between without going. And then again, the breathing is a great place to get started too. You can start that immediately. And Kaia has a fantastic breathing exercise that's 5 minutes long that essentially teaches you how to breathe correctly. And we need our pelvic floor to flex when we need it to flex and relax when we need it to relax. And that's what that foundational breath work is doing. So those two things alone were almost, for me, like 50% of my journey, because once I learned how to do those things, it became a trickle effect, and it affected everything else.
What's important about this is you're giving us tangible tools that can be done in a short amount of time and probably get results in a short amount of time that we could do here at the house if we just knew how to do it. You're telling me stuff that I'm like, I don't know if I know how to breathe correctly. I don't, so I'm going to be exploring the app and learning, and also I think this is probably a part two because we're not here forever today, but it instills a lot of anxiety in women. And I think that's where a lot of some of my anxiety started, when I wasn't sure, when you're unsure of being able to be out in public, sometimes it can cause a lot of internal trauma. And that's a cycle that doesn't help with your breathing. So it's almost like having to just take baby steps. And that kind of leads me to my next question. These baby steps, the support, Adrienne, what do you think for Kaia Health? What kind of support would that offer someone like me if I wanted to start this journey today? Where would I go to look, and how would I find, what kind of support is offered to someone like me?
Well, in Kaia Health, once you onboard onto the app, you can select, what body region you want to focus on first. And of course, you want to select pelvic health if that's your main thing. And then, you can go into other aspects as well. But everything we do is first based off education. We want you to educate yourself so that you know which direction you're supposed to go in. Is Kaia going to be appropriate for you? We'll give you that education. All of our exercise and education are evidence-based. So we'll let you know if Kaia is appropriate for you, if you should go in person. And then we also have the care team on the back end, like Nicole and I and Courtney and our other health coaches, to help you make that decision and make goals for what is best for you moving forward in your pelvic health journey. So all of our information is easy to digest, easy to understand, and then you can always implement everything at home first before you go to the next step.
I did notice that. As we said in our pre-conversation when we were chatting, I picked lower back pain because that's what I thought my most important need, because that was the need at that point in time when I joined the app. And it's interesting how it asks you a series of questions, so it tries to get to the root of the issue. And
Right.
it actually led me to the pelvic floor health, which led me to want to talk to you guys about this conversation. Okay, I would love to ask you guys, what is some advice that you would give someone that's starting out with this and they just kind of are dealing with it and they don't know how to take the next step, or they're a little afraid? And I'd like to ask you, like someone like me that's kind of just realizing some things, what advice would you give me?
Yeah. It's an incredibly common experience, whether it's postpartum or later in life, but that doesn't mean that it's normal, and that it's entirely treatable, that like all the other muscles in our body, we can work them and make them stronger. And understanding that knowledge is foundational, that education is how you build that foundation of long-term pelvic floor health. And it starts with really small, actionable steps. Starting with a bladder diary, starting with some short exercises, breathing, and catching up with a coach who can kind of walk you through the process and make sure that you can make those actionable steps happen.
I think that's really wise information. I don't think we're alone in this at all, and we're not broken. We can absolutely fix these issues. This is one of those things in life where if you put one foot in front of the other, this can be fixed. Nicole, I'd love to ask you the same thing. What is the one message that you would want someone to take away from this conversation?
I would just want everyone to know that you are not alone. As we've been saying, knowledge is power and your body is resilient. So just like you can fix other areas of your body through exercise and muscle work, you can do the same thing with your pelvic floor.
I love that. I love that all of the information you guys are giving me, it makes me feel like, you know what? Us as women, we're resilient. We deserve this care. We deserve to take care of our bodies, and we owe ourselves this time. And that this is like one of the best self-care. We talk a lot about self-care, in our world today, and this is something that I think should be at the forefront of that. Adrienne, what do you want someone to take away from this?
That overall it's not normal. There's a narrative even on social media where they will put videos out that I pee when I cough or when I laugh or when I'm playing with my kids, and the comments are like, oh, it's because you had a kid that this is happening, like this is so normal, but at the end of the day it's not normal. So don't think that it is. We can change the narrative of that by giving out this information and educating the community that what you're experiencing is not normal, but you do have the support and the resources and the tools for this to be treated and to be better.
Ladies, Courtney, Nicole, Adrienne, thank you so very much for taking the time to come today and share your wealth of knowledge and you're empowering us and making us feel like we have, there's help out there for us, and there's a lot of hope as well. That's the main message I want you as an audience that's watching this to know, that we can empower ourselves and there's a ton of hope, and also just give ourselves a little grace, because a lot of us go through this. So even though it is common, it doesn't have to be normal. And there are so many resources out there, starting with Kaia Health. I'm going to put a URL below here, so I hope you download the app, explore it. It's very user-friendly. You're going to love it just like I am. Also check out Women Like Me, which is encompassing this whole partnership. And I also want to talk to you. And if you are feeling any of these symptoms or you're experiencing them, you don't have to stay silent, and you just, as we've all echoed, you are absolutely not alone. I really hope that if you didn't personally experience anything that we're talking about today, you probably know someone, whether it's your mother or your sister or your best friend, or there's a lot of people I know that will benefit from this. We're going to keep this up here so they can use this as a resource. So I just want you to feel like you have all of the knowledge that you need to empower yourself, and give yourself a little grace as well, because it's tough sometimes, and take that one step forward. Thank you for joining us today, and I hope we see you on Kaia Health and Patients Like Me.